welcome you all after the festive season. This is our first Diabetes Educator show. Today we have a very important topic, that is role of seed cycling in hormonal and metabolic health in diabetes. And we have a very esteemed speaker, Miss Avijna Ray, ma'am. Ma'am, we welcome you on behalf of DAY. She is the Assistant Professor of Dietetics and Nutrition Department at NSHM Knowledge Campus, Kolkata. She is a NET JRF awardee, research scholar at Calcutta University, and a certified diabetes educator with expertise in sports nutrition and community nutrition. She will enrich us with her insights on this topic. Ma'am, now over to you. Please start.
Okay, thank you. Thank you so much for inviting me to today's program. So, Shubho Vijaya to all of you. I will straight away, yes, I'll straight away get into the topic. So, the topic is very relevant. The topic is, as you can see, it is seed cycling in hormonal and metabolic health in diabetes. So, seed cycling is actually a very, I hope the slide is visible. So, first, let me get into the concept of seed cycling. What is that? So, seed cycling is it is getting a lot of popularity nowadays. It is a nutritional approach where certain seeds are, we can take certain seeds in rotational way to keep our hormones in balance. Mostly it is used by mostly it should be used by the women during their menstrual period to keep their hormones in check, but it can be used by postmenopausal women as well, and also by men as well, to keep the insulin sensitivity in check. So this practice, seed cycling practice, it involves the consumption of specific seeds during different phases of the menstrual cycle to promote hormone equilibrium. So as we know that the menstrual cycle is a 29 days cycle mostly. So it has majorly two phases. One is your follicular phase, and one is your luteal phase. So majorly four seeds are consumed during this phase. Those seeds are flax seeds, pumpkin seeds, sesame seeds, and sunflower seeds. So each of these seeds has some unique polyphenols, some unique nutrients, which helps to keep the hormonal balance. It also helps to keep your lipid profile in check. In this, the next slide, you can see a picture. It depicts that how you can rotate this seed in different phases of your menstrual cycle. So as we can see that it's a 28 days cycle. So from day 1 to day 14, you can see from day 1 to day 14, that is your follicular phase. Okay, in the follicular phase, the hormone that is the most prominent hormone, that is your estrogen. So during that phase, anybody can take flax seeds and pumpkin seeds. So 1 tablespoon of flaxseed daily and 1 tablespoon of pumpkin seeds daily. Okay, during this first 14 days of your periodic cycle. So first 14 days means it starts with your first day of your last period. Okay, so that is your follicular phase. So during this time, if you take flaxseed and pumpkin seed, it will boost estrogen and it will keep the hormones in check, and it will maintain your period in proper time. And then you have your next 14 days, that is known as your luteal phase. So during your luteal phase, the hormone that takes over, that is your progesterone. So during that period, one should take sesame seeds, 1 tablespoon of sesame seeds and 1 tablespoon of sunflower seeds daily. Okay, so if that can give a boost to your progesterone hormone. So I will sum it up. So in your follicular phase, one should take pumpkin seeds and flax seeds. And in your luteal phase, that your next, the first 14 days, flaxseed and pumpkin seeds, and the next 14 days, from 14 to 28 days, sesame seeds and sunflower seeds should be taken, 1 tablespoon each of the seed. And this is how you're cycling your seed. This is how you're rotating your seed during the days of your menstrual cycle. Okay, for your hormonal balance. So as we know that nowadays, India is diabetic capital. We all know that many people are suffering from diabetes and other metabolic syndromes, metabolic disorders, lifestyle disorders such as women. PCOS and PCOD, polycystic ovarian syndrome, is a huge. It's a lot of women are suffering. A lot of women of their reproductive age, they are suffering from PCOS, and if it has been proven by different articles, it is research based. Okay, it is science backed that this seed cycle, if one take this, what the 4 seeds I have just told, in those time of your menstrual cycle, it will actually help to relieve or to prevent or to cure polycystic ovarian syndrome. And these all metabolic syndromes are interlinked in our body. So if suppose a person is obese, that can lead to metabolic disorders and hormonal imbalance, that can lead to PCOS, and that obviously will lead to insulin insensitivity. Okay, and that will lead to your type 2 diabetes mellitus. So, so this particular nutritional approach is helpful to prevent or to cure any kind of metabolic syndromes or lifestyle disorders that we nowadays, working women and men, we all suffer from. So let us just, I have just talked about four seeds: flax seeds, pumpkin seeds, sesame seeds, and sunflower seeds. So different, these different seeds have different nutrients in it. So they are called phytochemicals, right? They're like plant-based. So seeds are obviously plants. So it is plants. So vegetarian, vegan, anybody can take these seeds. Okay. Flax seeds have lignans. This is a kind of a fiber. Okay. It's a kind of a soluble fiber. And omega-3 fatty acid, which we know that omega-3 fatty acid is an essential fatty acid, and other soluble fibers. Pumpkin seed also has very important minerals like zinc and magnesium and other antioxidants. Okay, so these two helps in your estrogen boosting. Okay, they also have the phytoestrogens. And then we have the sesame seed. It has got sesamine. It is also a plant based. It's also a phytochemical. It's a super nutrient that is there in your sesame seed. Then we have calcium and polyphenols in the sesame seed. It will all help to not only to maintain your, to regulate your hormonal balance, it will also help to, it has been seen that it will help to reduce your blood sugar level, and it will reduce your lipid profile. In that case, reduce your LDL cholesterol and your triglyceride level. Then in sunflower seeds, we have vitamin E, which is an important antioxidant, and other phytosterols. Okay, all these are good to reduce inflammation in the body. So, what are the hormonal benefits of these seeds? So, phytoestrogen, as I said, that phytoestrogens are plant estrogen that are present in mostly flax seeds and also in pumpkin seeds. So, that helps to regulate or to keep the balance of estrogen and progesterone. Mainly, we have to keep the balance of these two female reproductive hormones for our regular periodic cycles, to maintain our regular periodic cycles. So, the women who are suffering from PCOS, they suffer from they suffer from irregular period. So if they take all these seeds in those rotating manner, it can really improve their syndromes, PCOD syndromes. Okay, and it has been seen that these seeds can also improve the disorders or the symptoms that comes with menopause. Okay, and it obviously it improves your menstrual irregularity, and these seeds can impact your it can improve your insulin sensitivity, and it can reduce your blood sugar level. So if someone is pre-diabetic, if that person not yet diabetic but pre-diabetic, or maybe the test has given glucose intolerance, it has been like the blood sugar is not yet diabetic but pre-diabetic. So if that person also can have these seeds in this manner, they can actually check their insulin sensitivity. It will improve your insulin sensitivity, and that person might not progress into diabetes. Then what are the metabolic benefits in diabetes? So we just talked about mostly the hormonal benefits, the progesterone, how these seeds can help because they have phytoestrogen. So how these seeds can help to balance the estrogen, progesterone, and also your insulin and glucagon. So there are some metabolic benefits as well in the diabetic control of this particular seeds. So glycemic control. So flaxseed, all these seeds have high levels of insoluble fibers. So we know that if we take fibers, it will slow down the raise of blood sugar raise in our body. So glycemic control is flaxseed is full with your soluble fibers. So it has got glycemic control. It slows the glucose absorption in our body. So our blood sugar spike won't happen. Then lipid profile, it improves the lipid profile. It reduces your LDL cholesterol and triglyceride, and it raises HDL cholesterol. So cholesterol, we know that in common terms, we know that HDL is a good cholesterol, and LDL is your bad cholesterol. So these seeds can improve your HDL cholesterol and you can reduce your LDL cholesterol. And they are all anti-inflammatory in nature, because we know that all this lifestyle disorder, our body undergoes a lot of oxidative stress and inflammation is high. And the biomarkers of the inflammatory biomarkers like C-reactive protein, you know, interleukin 6 and all. So they will be, these blood parameters are raised in case of if anybody is suffering from any sort of lifestyle disorder. So these seeds are also anti-inflammatory in nature. It will reduce our oxidative stress in the body. Because as I told you, that antioxidant vitamin E is an important antioxidant that is present in the seeds. So they obviously they will reduce the oxidative stress in the body. And weight management, because we all know that fiber helps to check our weight as well, because fiber has got a high satiety value. So we won't feel hungry if you take these seeds early in the morning. So then just a little bit science behind it, that what are the mechanism of action. So what are the mechanism? Number one is it modulates your gut microbiota. So and that leads to a better glucose metabolism. All right. So gut microbiota, because we know that in our large intestine there are we harbors a lot of good bacteria. So for those bacteria to flourish, we need, so that bacteria thrive on prebiotics. Okay, prebiotics. So this seeds has high fiber. So those fibers are prebiotics, and in our gut, the good bacteria, they feed onto those prebiotics and they flourish, and that will lead to your better blood glucose control. Okay, because what happens, after the bacteria, the good bacteria, they thrive onto, or their food source is your soluble fibers and your fibers, that is your prebiotics. So after the metabolism, they will give a product that are known as short chain fatty acid. Okay, short chain fatty acid. So it will increase the level of short chain fatty acid in our body, and that leads to better glucose metabolism. Short chain fatty acid, the raised short chain fatty acid level in our body, it will lead to better glucose metabolism. It will enhance your insulin sensitivity. And another mechanism of action of these seeds are they activate PPAR pathways. What is PPAR pathways? It is peroxisome proliferator activator receptor. So PPAR is peroxisome proliferator activated receptor. So these receptor are nothing but they are nuclear receptor. Okay, they are nuclear receptor, and they regulate certain genes which control the fatty acid oxidation in our body. Okay, they are nothing but nuclear receptor which controls the genes. They control the fatty acid metabolism in our body and fatty acid oxidation in our body. So basically, they do what? They control the lipid profile. So the PPAR pathway, so they reduce your LDL cholesterol, the bad cholesterol, reduce your triglyceride levels, and it will increase your HDL cholesterol. And also, it will improve your glucose metabolism, your blood sugar level will go down, and then your insulin sensitivity will go up. Then they reduce AGEs. What are AGEs? So AGEs are advanced glycation end products. AGE is nothing but it's advanced glycation end products. That means that is like nothing but in our body, if we have raised blood sugar, no. So what happens? The blood sugar, they attach to protein and lipids. That glucose, they attach to protein and lipids. So those protein and lipids which are attached to glucose, they are known as the advanced glycation end product. And that will prevent the protein and lipids to do their normal functions in our body. So AGEs are not good for our body, okay? And these seeds help to reduce the AGEs. So this seeds has so many medicinal values or nutritional benefits. What they do? So number one, our gut microbiota, they improve our gut microbiota, because our gut microbiota, it feed on the soluble fibers, and that will raise your short chain fatty acid, and that will lead to better blood sugar control. And through this activated PPAR pathways, it will also control your lipid metabolism and your glucose metabolism. And it will reduce the harmful AGEs in our body, these seeds. Okay. So now we have known the beneficial role, or what are the nutrients and what they do, what these seeds actually do when we consume them in our body. So the mechanism, the biological aspects of it. Now the practical application, that means how we can take these seeds, right? So nowadays these pumpkin seeds, flax seeds, sunflower and sesame seeds, they are we can get it into any supermarkets, and if you can like order from big basket and stuff like that, you'll get it. So what are the, how to have this? So you should have like in the follicular phase, as women who have their who are in productive age, so they can take in the first 14 days of their menstrual cycle, that is the follicular phase. One should take 1 tablespoon of flaxseed and 1 tablespoon of pumpkin seeds. Okay, and your luteal phase, that is your next 14 days, you should take 1 tablespoon of sesame seeds and 1 tablespoon of sunflower seeds. So this then the main can think that what can we do? So I have just given this information as well, that this is not only for the women who are in their menstrual cycle. It this seeds also men and postmenopausal women can also take in this manner only, in the rotating fashion, to control their blood sugar level. Okay, so now I'll come to that how you can take this seed. So I just told that you should take like 1 tablespoon of each pumpkin and flaxseed in your first 14 days, and 1 tablespoon of sesame and your sunflower seed in the next 14 days of your cycle. But how to take it? So you can, so as I said, that you can get all these seeds in your like supermarket. So it comes in raw form, and probably it comes also in the dry roasted form. But if you buy it from the market in the raw form, you can do one thing: you can dry roast it and then keep it in a jar, put it in a place where it is not perishable. So keep it in a jar, the dry roasted form of it, and you can have it every day morning, 1 tablespoon. So if you choose, and you can also powder it after dry roasting. Okay. So if you choose the powdered form, be sure to prepare and consume it on the same day. You cannot store the powdered seeds. If it is a raw, like if you first thing you should dry roast it. Then you can make it a powder, or you can take the dry roasted seed as it is. So alternatively, what you can do, of course, you should dry roast the seeds, store them in the bottle is the best way to use it. Dry roast the seed first, then store them in a bottle, keep it in a area where it is, properly kept, it's not perishable there. And you should take 1 tablespoon of the seeds, flax seeds and your pumpkin seeds, and then your sesame and your sunflower seed. So how you can either add them in your salads, you can add them in a yogurt, you can take some yogurt and some fruits and add those seeds there. So it is much more, easily, it's palatable that way also. And but the quantity has to be the same. Okay, precautions here. So there are some precautions as well. So excess intake may cause digestive discomfort. Suppose a person has never taken this kind of seeds before. So I would suggest that start taking from the it is given you should take 1 tablespoon, but if you like start doing it, but if you have some, probably you're having facing maybe some minor digestive issues, then reduce it, then again start it. And obviously this should not be a replacement for your medication, it should be a supplementation along with your medication. People, and those people, a lot of people are, they suffer from nuts and seed allergies, they should absolutely avoid it. You should talk to your doctor or your dietitian or your doctor and check yourself whether you have the seed allergies, and then only you should move to having them. So, and also monitor your blood glucose level while incorporating these things in your diet. So, a lot of research, as I told you, these all information are science backed. So there are many researches that has been done, like this one mentioned the systemic review and meta-analysis. It shows that they have actually done this intervention study. So by using the flax seeds. So what this study has, the result has shown that flax seed supplementation tends to improve the glycemic control and insulin resistance in pre-diabetes and type 2 diabetes patient. So as I told you, someone is pre-diabetic yet not diabetic. So if they start to take these seeds, so it can prevent them to progress to diabetes mellitus. Okay, so studies have shown these results. And also another study has been done on the use of flaxseed supplementation significantly. So they have seen that flaxseed has significantly reduced HbA1c. So HbA1c is also one of the important biomarkers of diabetes. It shows you the idea of last 2 to 3 months blood sugar level in your body. So it has been proven that flaxseed, if you take flaxseed 1 tablespoon each day, it will reduce your HbA1c in the patients who are actually suffering from type 2 diabetes mellitus. Uh, so there are some limitation and precaution, limited clinical trials. So obviously, a lot of research has been done on this field, but many more researches should be done in future to back completely to back up with this information. So researches are ongoing, and this is an adjunct therapy. That means it is a supplementation or a complemented therapy or supplemented therapy along with your medications and along with the if the people who are suffering from diabetes, so obviously they are in portion control as well. They are in certain diets which will benefit to reduce their blood sugar levels. So they are already in a low carbohydrate diet, in a carb counting diet. So along with that, if they take the seeds, it will definitely better their blood sugar level. It will definitely control their blood sugar. And obviously, you should be cautious about your allergies and whether you're allergic to seeds and this nuts or not. Okay. So conclusion, I will say that seed cycling supports your hormonal balance and your metabolic health. So your estrogen progesterone level, if you're a woman, the estrogen progesterone level will be in check, and your PCOS will will get reduced, and it is good for your metabolic health. It is good to reduce your your blood sugar level, also your triglyceride level, your LDL cholesterol level. It improves insulin sensitivity, lipids, and it reduces your inflammation and reduce oxidative stress in the body. A functional food, this is a functional food strategy in diabetes. So in these slides, I have mentioned majorly these four C's, right? Because these four C's are used in the rotating manner, mostly in your women who are in their menstrual cycle. So flaxseed, pumpkin seed, then your sesame seed and your sunflower seed. But apart from that, purely to control diabetes, there are a few other seeds which are not mentioned in my slide. Those are your fenugreek seeds. So as we all know that fenugreek seed is very, now it has been completely proven that fenugreek seed is as a proven therapy for to control your blood sugar. So because fenugreek seed also has soluble fiber, it's very good for your glycemic control. So in the morning, if you take 1 tablespoon of fenugreek seed, it's very good. Okay. So then you have your kalonji seeds. Kalonji seed is probably some black like seeds. You can get it from your supermarket or grocery store. Kalonji seeds are also proven. It has got medicinal properties, and it has been proven to reduce diabetes. Then watermelon seeds. Watermelon seeds are also good because watermelon seeds also have certain minerals, magnesium, iron, and zinc, and they are great replacement for unhealthy snack as well. So also, not only they have got all these beneficial roles, as I told you, that they give you satiety. So it can be, you can replace your unhealthy snacks with these seeds as well. If it's roasted, if it is dry roasted, if you take like 2 tablespoons of these seeds, your stomach will also be filled for a particular time. So I have mentioned, apart from these four seeds, which are your pumpkin seed, your flax seed, sesame, and sunflower seeds. Apart from that, fenugreek seed is very good to control blood sugar. Then kalonji seeds is also good. Watermelon seeds are also good. Then chia seeds, we all know chia seeds. Chia seeds is very much in trend now. So like water soaked chia seed pudding and all, they are also good. Why? Because chia seeds, they are also very rich in soluble fiber. And so if you take a overnight oats with chia seeds, and then overnight oats with chia seeds, then after overnight your chia seeds will swollen up, and it will just give more satiety to you, and you put some fruits there, some fruits which are low in glycemic index, and then you put your dry roasted seeds over that. It will be a great snack, and it will be very good for you, and it will also not spike your blood sugar. Then pumpkin seeds I have already covered. So then again, I'll just conclude that four seeds. What are your the first? If you are a menstrual period, if you are in the menstrual period, first 14 days, that is your follicular phase. You take your pumpkin seed, you take your uh, pumpkin seed and your flax seed in the first 14 days. Then you take your sesame seed and your sunflower seed in the next 40 days. Okay. And apart from that, just purely to diabetic control, you can take fenugreek seeds, you can take kalonji seeds, you can take chia seeds, you can take watermelon seeds. So these all are very beneficial to control your blood sugar, and they are a great replacement for your unhealthy snack. So yeah, Sukona, this is what all I have in my presentation.
Thank you, ma'am. Thank you for sharing such a valuable insight with us. Thank you.
Yeah,
Ma'am, there is one question in our chat box that
yeah, yeah, yeah.
what is advanced glycation
Glycerin end
in
product.
product? Yes, yes,
Yeah,
in product.
yeah. That okay, okay. Just okay. So yeah, I already explained it. I'm again gonna explain that. So advanced glycation end products. This is nothing, as I told you, if a person is suffering from blood sugar, high blood sugar. Okay, so our body in our blood also there's high blood sugar level. So that free blood sugar, that glucose binds with proteins and lipids in our body. They're not supposed to bind with protein and lipids. So this protein and lipids, which are bound to glucose, they are known as advanced glycation end product. Glycation means glucose, that's carbohydrate. So these protein and lipids which are attached to glucose, they are known as your AGEs or advanced glycation end products, and they are harmful for our body because protein and lipids are in our body to do certain functions. Proteins are part of our hormones, enzymes. Lipids are the content of your plasma membrane. So if they are attached to glucose, they cannot do their normal functions. So this AGE is advanced glycation end products are nothing but lipid and proteins which are attached to glucose. They are high in the person who is suffering from high blood sugar level. So this helps to reduce these AGEs. So these AGEs are harmful. Yeah.
Thank you, ma'am. Thank you. Ma'am, we look forward to learning you from another session. Thank
Sure,
you.
sure. It'll be my pleasure. Sure.
And thank you,
Yeah.
all the audiences who are always join with us. Thank you, ma'am. Good night.
Thank you so much. It's a great pleasure. Thank you. Thank you. Should I stop share?